If you go to Professor Bogart's Pediatric Nursing on the YouTube channel, you will find part 1, part 2 of the 90 question Kahoots. That's right, I increased it. I redid that one completely. That's probably the most up to date with concepts, but you're going to see if you've looked at that, this 100 question Kahoots is going to be a lot of those concepts repeating, and you're going to be able to see, hey, I need to look at this concept and how can I apply it. So there's a lot of stuff. So let's see if anybody wants to win this one. It's 100 questions. You can stay as long as you can. I understand sometimes you got to go, but it is being recorded. And I will be getting this up here tonight. You will have it on the YouTube channel. If your professors don't have it posted on your announcements, just go to Professor Bogart, Pediatric Nursing, and it is listed just like that in YouTube. You can find it. It's not hard. You don't need invitation. It is public, okay? So I need at least 2 people to play with me.
Oh, something happened.
Valerie, do you know how to go to Kahoot.it? You need to have your computer on and then use your cell phone. On the cell phone, you could hit the colors. And you're going to see actually how much you can learn by playing a game if you do it my way. It's okay, we'll catch you up, Valerie, not a problem. We'll get you there. All right, there we go. Look at that. She made it. And let's get going. Now, I will be talking over this. I'll be giving you a lot of information. So if you need an answer to a question, please stop me. I'll answer your questions. I'll multi-select. What are the signs and symptoms of pyloric stenosis? So pyloric stenosis is your infants. Usually about 3 weeks to 3 months, you will see these sort of things, okay? And it's literally projectile vomiting, okay? So when you get an infant telling me that, oh, my baby's been vomiting, that's why I brought him to the doctor or to the ER, I'm gonna ask, is it dribble or is it pow across the room? Because it literally can hit somebody's foot 12 feet away. But then the next thing I'm going to do when I see it projectile, I'm going to put my hand underneath in the middle, underneath her xiphoid process. And right around the right upper quadrant, mid abdomen, you can actually feel an olive. It actually feels like a little marble. And then because no food's going down, of course, you're going to have decreased urine output. And they're hungry, they're crying, they eat, they're full, and then immediately it comes up. So these kids are crying for hunger. Another multi-select. Signs of acute respiratory distress in an infant include. Now there are some specific signs and symptoms here that are specific to infants. I mean, many children can have some of these symptoms, but infants, remember, they go in respiratory distress, you're in trouble. And the biggest thing is that grunting. And the grunting means you'll see nasal flaring, their little noses go in and out, and at the end of a breath, you hear, eh, eh, eh. And then signs of respiratory distress in an infant, respiratory rate of 52, probably it's going to be a little higher than that, but you're going to see tachypnea. There'll be coughing, nasal flaring, grunting. Nasal flaring, grunting are the big ones for infant. There you go again, multi-select. When caring for a child, they suddenly stiffen and they have a seizure. What should you do? You walk in a room and you say, oh my goodness, this child is having a seizure. You know, when you think of seizures, you always remember safety. There's not much you can do to the child. You could protect their airway by turning him to the side. You can put the bed flat, take the pillow out, pad the side rails if with the blankets or pillows if you have them. And then of course, if there's a response team, you'll be calling them. But monitor, when did it start? When did it end? What did it look like? So you can document it. So seizures a lot is all about safety. There you go again. What may be a problem seen in an infant after open heart surgery? So infants with open heart surgery, you have cyanotic defects and you have the acyanotic. So was it with or without oxygen is basically you have to ask about it. But remember, we've opened a heart and we've looked at it. And when you open a heart and look at it, it's gotten weak, okay? So if they start not eating good and they're tiring easily, so they're not eating what they should, you're going to listen to their lung sounds right away. Probably because the heart's not pumping the way it should, you're probably filling up with fluid. So respiratory distress, listening to that lungs being filled with fluids, we know that that child needs a little bit of, diuretic, some furosemide, maybe some digoxin to slow and strengthen the heart. A young man who has cystic fibrosis wants to have children. How do you respond about that? What do we know about cystic fibrosis and being reproductive? What do we know? Well, we know males who want to have children who have cystic fibrosis cannot because they don't have what we call a vas deferens. It has to do with being able to deliver sperm, to the female. Now, somehow, some way, and I don't know exactly how, after bilateral lung transplant, about a year later, they can have children. So if a young man gets married, wants to have children, they're going to have a lung transplant, bilateral lung transplant to try. An infant with tetralogy of Fallot has a Tet spell. What do? How do you treat a Tet spell? And let's say this is the infant. See, there's an infant and you just take their knees and you poof to their chest right away. What do older children do that have not been repaired? All of a sudden you'll see them squat. They'll sit down on their feet, basically, standing up but squat. And that does the same thing as knee to chest. So they know how to take care of themselves without even telling them. They do it by themselves. Multi-select. The nurse should assess the infant with congenital heart disease for which early signs of heart failure. This goes along with the other question I just asked. We had congenital heart, just had surgery. We're talking about they're not eating well, right? That's when you start to see them fatiguing early. They're not going to eat well. We know something's going on. And then because the heart's still trying to get oxygen around, it's going to start to try to beat faster to keep up with it. So tachycardia, tachypnea, not eating well, fatigues, all of these things are telling you something is going on. We're filling up with fluids. We're going into failure. The nurse provides instructions to the parents regarding administration of digoxin. Need for further instructions? When do you know? Infants and children do get digoxin, and determining side effects are difficult, but there are certain things they can show you, especially infants. There's really not much difference between giving it to adults than it is for a child, is it? Now, when you have an infant, a small child, and they can vomit, this could be showing you signs of digoxin toxicity, right? So if the child vomits, you'll repeat the dose. Oh, no, you won't. If the child vomits, you should hold the dose and have, if it's going home with a parent, they should call the physician and probably go in and get a digoxin level before we give any more, okay? So you You will not mix it in food, any food for children, unless it's a tiny little spoonful that you can monitor. You will be taking a pulse on an infant. If it's below 90, you will hold it also. And you're not going to, if you have to hold a dose for whatever reason, you need to have that healthcare provider when to give you the next one. Your child's been playing outside in a field with long grass. What would be a priority? What do you need to do? In a field, long grass. What are you worried about? And that's all about ticks. And how do you check for ticks? And what would you do if a parent called you about it? Well, take their clothes off and check everywhere. And if you see the tick buried into the skin, you take tweezers and try to pull them out. And if you can't get it out, you go to the doctor or to the urgent care and let them do it. A toddler presents with severe abdominal pain and the diaper has current, jelly, and bloody stool. What diagnosis do you think this is? Toddler, ages 1 to 3. All of a sudden their tummy, it hurts. Usually their legs are kicking, they're inconsolable, they hurt. And then you look at the diaper and there's current jelly. You see current jelly, think intussusception, okay? Hirschsprung's is at birth. They would not be having stools or ribbon stools, whoever put Hirschsprung's. A 6-month-old is placed on thyroid replacements for congenital hypothyroidism. What shows you that it's been effective? How do you know if thyroid replacements have worked? What's the one difference between adults and children that I've always said that you can look at to see if it's effective? We know they are intolerant to cold, they have dry skin, sparse hair, but cognitively, they will be delayed, especially an infant. If they don't get enough thyroid hormone, they're not going to be able to lift their head up and roll over and sit up and do the palmar grasp, not the reflex, because that's just a reflex, but a voluntary. They won't be able to do it. So you will see delays in developmental level if the thyroid hormone has not been effective. If they can lift their head up, roll over, we know it's working. An infant should be able to sit unsupported at what age? How many times you'll get questions from parents? Well, my other kid was standing up and almost walking at 9 months. Why doesn't my kid not be able to sit? What's going on? So approximately, it's about 8 months of age. You know, I've seen children that never crawled, they got up and they ran, they never walked. My children and my grandson, they never took a step. They ran the first time, but it was about 15 months of age, not at that quote 12 months where it should be. So as long as they're moving forward, we know they're not in delay. I'll multi-select. What assessment would a nurse see with a child who is dehydrated? I mean, this is important when you look at, how about that infant with pyloric stenosis who keeps vomiting everything? What about the kid with diarrhea, vomiting? Dehydration is very serious for children. So when we don't have enough fluid in our body, what do we see? Well, the infants, the really cool thing is they're going to cry, but there's no tears. You're like, wow, this kid is crying. And you're like, there's no tears. That's dehydrated. Decreased urine output, prolonged capillary refill, heart rate elevated, blood pressure down, all of those things show dehydration. Growth hormones are started on a child. What assessment will show that the medication has been effective? So subcutaneous injections are given every day to help a kid grow. Now, we stop giving this when the kid stops growing less than an inch a year. If they're still growing an inch, they'll give it, but less than that, they won't. But how do you know it's been effective? Well, it's growth hormone. They're growing, very simply. Growth hormone means that they're growing. because we give it for kids who are short in stature. One of the symptoms of rheumatic fever is chorea. What would you tell the parents about these movements? Rheumatic fever is due to what? Strep throat, right? You're going to see rashes. You're going to see nodules on the fingers, the hands. You're going to see these movements of their feet shuffling and falling over with ambulation and walking. Now, it is due to a strep throat. So everything will be reversed except for heart valve damage. If you've damaged your heart, you let it go that far, you're still going to have heart valve damage. But even the chorea, which is sometimes why they go in, the kid keeps falling over, something's going on. They're not walking right. What's going on? And that's usually will trigger them to find out. They find the rash, the fever, et cetera, and then they know how to treat it. A 2-month-old is worried because the back of her child's head is flat. What should you tell the mother? I mean, today, what do we tell all of our parents of a newborn? Back to sleep, put them to nap. You put them on their back because it has less chance of SIDS death. Now, there are times where your 2-month-old is awake and we do tummy time. Place them on their abdomen. Now, their heads are so soft and so pliable for their first year of life that when you turn them over, it helps keep their heads round. So tummy time is important for development, and it's also good for their head not to be so flat. What statement from a parent would be concerning regarding a child diagnosed with croup? What is croup? Laryngeal tracheal bronchitis. It's barking cough. And by itself, it's not much, but remember, this is the oropharyngeal airway. With all that coughing and irritation, it swells. Now, if you're now having trouble swallowing, you're getting to the point of epiglottitis, because croup, untreated, can turn into epiglottitis. So they're not swallowing. Now they're going to start to drool, tripod position, leaning forward, garbled voice, all of that will pursue. So if they're starting having trouble swallowing, get them into the doctor, get them to the ER, urgent care, let them be seen now, not tomorrow. A child has myopia. What would be inappropriate for the nurse to tell the teacher? Myopia. You know, we've had strabismus, you know, we have had amblyopia. What is myopia? Well, myopia is they don't see well, right? So it's nearsighted, they can't see far. So as a teacher, what would you do? Oh, put them in the front of the room so they can see the board, right? Oh, multi-select. A child is born with a myelomeningocele with sensory and motor deficits. You must be careful with what? Remember, myelomeningocele is that big purple blob on the low back. It means the meninges and spinal cords were born on the outside of the body. So they stretch those nerves on the lower extremities to push it back in there also. So there's going to be nerve damage to the lower extremities. Think about the low extremities and you think of the nerves there. Well, it does affect the bladder. Many of these children do not feel when they need to urinate and must get frequent bladder catheterizations. You have to be careful, absolutely, with latex care. Now, myelomeningocele is only the lower extremities, so it has nothing to do with the lungs. And we don't need aggressive physical therapy. We just need to keep the lower extremities moving with just regular physical therapy. But latex is a big thing. You know, the day they're born, that sign goes up on their charts right now, latex allergy. What interventions are needed for an immunosuppressed child that has a platelet count of 10,000? Well, let's take away all of the other stuff and just put a client who has a platelet count of 10,000. What do you need to do? Well, platelets have to do with bleeding, has nothing to do with infection. That's neutrophils and white blood cells. It has to do with hand washing. It is that bleeding. Platelet counts. Remember idiopathic thrombocytopenia purpura, that ITP? That's all decreased platelets. So decreased platelets, you worry about bleeding precautions. No IM injections. Watch out for brushing their teeth, soft tooth combs, looking to see if there's bleeding in their urine and their stools and ecchymotic areas. All of those things, bleeding precautions. An infant was seen in the emergency room for a febrile seizure, and the mother asked, "Does my baby have epilepsy?" What are you going to tell her? You know, febrile seizures are the most common of all seizures, but usually by the age of 6, they'll grow out of them. Epilepsy is not one seizure. It's multiple seizures in a day, okay? And it continues by day. So many of these children, they grow right out of it, and it's only a one time. My first grandson had it. He had it one time. That was it. An 18-year-old parent wants their child's lab results. So mom and dad came in when an 18-year-old was seen, and they had to draw labs, and they want to call up, they want to know what their lab results are. Can they do that? You cannot give any 18-year-old and above that are cognitively aware their lab results to anybody but to themselves, unless that child says it's okay, you can give it to them. And you need, if it's a delayed result, that the child must write a permission that, yes, you may give out the lab results to my mother, you know, like a consent for them. Really good and HIPAA important rule there. What is Balvisimab, Synergist, used for? So Synergist is for the RSV. RSV, who do we give it to? We give it to infants ages up to 1 year old. It's monthly. And these are children that were premature, cardiac, immunocompromised somehow, that a little bit of mucus in their nose would really have them struggling. I mean, infants, they're ambulatory nose breathers. They don't know how to breathe out of their mouth. Put all that mucus in their nose, they can't breathe. So with a bad heart or bad lungs, we're going to prevent that mucus, which is what RSV does. And we're going to give them a vaccine monthly from like fall, late fall, winter to early spring. What medicine can be used to treat an infant that is in the acute stage of RSV? So you have an infant admitted to the hospital, really struggling. There is medicine that you can give for RSV, not the immunization, but it's ribavirin, the Virazole. Actually, it is pink, like a pinky purple aerosol medicine, and we give it, and it's an antiviral because RSV is respiratory syncytial virus. So Virazole is for viruses, so we would be given that. What is the highest priority for a pre-op infant with bladder exstrophy? This is when the bladder is born on the outside of the body. We've heard about gastroschisis, where the stomach is born on the outside. Bladder exstrophy is when the bladder is born on the outside. The biggest thing about any body part not born inside the body where it should, you worry about infection. So cover it with a dry, sterile dressing. And of course, wearing gloves, and protecting the child is what we need to do. That bladder still works the same. You still have a diaper with urine coming out. There's not a problem with any of that. Just got to get it back where it needs to go. A smart 8-year-old wants an insulin pump for the type 1 diabetes. Now, the insulin pump means that you have one little needle you put into the abdomen, and that pump can be there 10 days, 2 weeks, depending. And it's just going to deliver a little constant insulin. Now, the thing about this child, it is a good option if they can troubleshoot the pump. If they are old enough to understand the pump, and if something happens, what to do if there's like a misfunction or something, or testing their blood sugars, they need to get a bolus. If they can work it, absolutely they can have it. Okay, it's good for that 8-year-old, and it's also good, you know, going up to those kids who really can understand how to use it. I'll multi-select. Why would a Lyme test be done on a child? What is a Lyme test about?
Did you want an answer to that question?
No, just put it down on the in the Kahoots if you're doing it that way. So a Lyme test, we know that we get these by tick bites. We get tick bites if we're like in fields, long grass, in the woods, those sort of environments. And you should not be able to get a positive one, if it's going to be, until 1 to 2 weeks after exposure. And you'll see the bullseye rash, and that will make you want to check for it. It has nothing to do with bacterial endocarditis, okay? It's different. I'll multi-select. What assessment would you see after administering an IV bolus of albumin to a child? We use this a lot with nephrotic syndrome. Nephrotic syndrome is protein loss like crazy, right? It's not renal failure, it's just proteins lost. So even the blood doesn't have protein in it. So all the fluids goes into the tissues. So you're full of edema. And in order to get rid of this, we need to replace the albumin or the protein in there. It pulls out all of the fluid from the interstitial spots, goes back into the blood through the kidneys. So you see an increased urinary output. Also, because we're getting rid of a lot of this fluid, we should see a decreased heart rate that's going on with that. But albumin is usually followed by a dose of furosemide, because you give them the protein, it goes back into the blood system, pulls out the fluid, and then furosemide pushes it out, and you have a really large urinary output. A male infant is born with epispadias, and they cannot circumcise the child. Why? Epispadias, hypospadias. What is that? Epispadias, hypospadias is when the urine comes out, like epispadias on top of the penis, could be anywhere on the top, or hypospadias anywhere on the bottom. It doesn't come out the tip of the penis. Somewhere before about a year old, they say 6 months to a year, they want it before they're going to even potty train. That's the big thing. But they'll take the foreskin and use it as a plastic closure. If you look at week 8 PowerPoint, I've got a beautiful surgical picture there, which really shows how they splay open the penis and shows you why they need that big piece of tissue. They need it. Also, what and when does this become a problem? What about your Jewish faith? They like to do a bris, right? It's part of their routine. They cannot. Okay, so it really needs to be explained to them really well. It's not that we don't want to let you, it's just it's not good for your baby. A child's wheeled into the ER leaning forward, drooling, no cough, severe stridor. What do you think that is? The key word is drooling, no cough. This is croup that's gone too far. Now it's epiglottitis. And you hear that garbled sort of voice. You can barely even hear them talk. Epiglottitis. That is a real and true emergency. Another multi-select.
Oh, Lord.
To diagnose Duchenne muscular dystrophy in children, an EMG may be done. What teaching do we tell to the child and parents before it's done? Now they take these little probes and they shoot a piece of electricity, a current, and it makes the muscle contract so they can see how good the muscles are working. I had it done, and it does hurt. It really does. It's really uncomfortable when it's done. So it measures how weak those muscles are for sure. And remember those muscles, because maybe they haven't worked that way in a while, maybe they're going to be sore. So Tylenol, Motrin, and let the parents know it's just for a little while. It won't last too long, the soreness. A multi-select. What conditions would you suspect on a newborn Down syndrome infant? When you're talking Down syndrome, you always are concerned about any congenital heart disease. It could be as simple as a ventricular septal defect, or it could be a truncus. Could be a lot more. Also, Down's children, we need to regularly test them for hypothyroidism. They're more susceptible to hypothyroidism and actually leukemia also. So these are things that should be watched very closely. A child admitted for persistent vomiting and diarrhea, what assessment is most important? What assessment is most important? You know, it's all the above, right? But what can you do right away? What assessment can you do? An apical pulse. And if it's elevated, your fluid volume depleted, right? It's the easiest way to check. I mean, urinary output, yeah, if it's decreased, but you don't, that's more subjective. You objectively can tell by that pulse, yes, this child is dehydrated. Skin turgor, but still, again, sort of subjective. Apical pulse, and of course, blood pressure. Another multi-select. What information would the parents and child need to understand about Impetigo Infectiosa? My grandson came to me last fall with what mom thought was a mosquito bite that he itched too much, and it got really juicy, oozy behind his leg. And it started to get more and more and more. It is a really, really infectious staph infection. How do we treat this? Well, thank goodness I had Bactroban at the house, which is a very powerful, that's one of those prescribed antibiotics, but it also needs oral antibiotics. I had to be very careful washing my hands with this. And let me tell you, it kept spreading and spreading. And where it was, he kept cracking it every day just by walking. He was out of school for a week with this. But the only thing is, especially depending on some types of skins, it can leave these slightly reddened scars. I still, on my child, can see it. He has Hispanic in him. So he has a little bit of a darker skin coloring. So you can see slight red scars, but mostly it has gone away. But that was pretty scary. I said, Dania, your child isn't, Impetigo. This isn't him scratching. He needs to be called a doctor now. Multi-select. What is another word that's used to describe erytheum infectiosum? And that little kid is showing it. It's a viral infection. It's big rash, this big round purple edges that sometimes itch like crazy, with fevers many times. These are your school-age children, but it is also called fifth disease or slapped face. It looks like they slapped their face because it's got these big red cheeks on it. How do we treat it? It's a virus. Tylenol, Motrin, fluids, rest. What is a treatment for pertussis? Now you're going to say there's immunizations for it, right? Not every child gets immunizations like we would like. There was an outbreak a couple years back here in Miami with pertussis, and it was children who were not vaccinated. And it's Zithromax. Zithromax is a treatment for pertussis. It's an antibiotic. These children get really sick. They usually will need to be admitted, but they are so respiratory, you know, you have to really be careful. So they're put in these laminar blood flow, airflow rooms, which means the air from the room does not go through the hospital, has its own aeration to the outside so that you can't spread this respiratory free virus bacteria into the whole hospital. But it is a very scary thing. But we're treated with antibiotics, Zithromax. Another multi-select just for you. What are some side effects to watch for a child that has taken antibiotics?
Diarrhea. Whoop.
So many times side effects, antibiotics is nausea, vomiting, abdominal pain. Many times this is expected. A lot of times the physician will warn you. Sometimes they'll even put you on probiotics. Sometimes it helps, you know, with the GI tract. Or if it becomes too much, they'll change the antibiotic and they'll just say, if there is a choice, have your child take a different antibiotic. They're not allergic, it's just an intolerance. How do you get rid of cradle cap on an infant? So you have this white, crusty looking dandruff on your infant, and you don't want your infant to be so pretty and the hair comb. You got this crusty stuff there, right? And I know it's horrible. What we do is it's not going to be cured in a day, but wash their hair normally and just take something to moisten it like mineral oil, and then just this fine tooth comb gently. It's not coming up in one day. It's going to take several days, but that's the way you loosen it and you start to get rid of it, okay? Remember, there's a fontanelle right there, so you got to be careful. Another multi-select. Post-operative abdominal surgery child has an elevated heart rate and respiratory rate. What assessments might you make because of this? What is going on to this child? Elevated heart rate and a respiratory rate. They're elevated. They're hurting, right? Most likely. But don't forget, fevers do cause elevated heart rate too. It actually could be a combination of all of them. So what would I do? Well, if they're available, I'd give them their Tylenol or Motrin if they can take it. I would also give them something for pain. You can combine those. In many cases, it's what they need to make them feel better. A mother whose child is undergoing chemotherapy asked the nurse about giving her child immunizations. What should you tell this mother? Child's going under chemotherapy. And you know, they're due for these immunizations. And what they say is delay vaccines for at least 6 months. Because right now you have such an immunosuppressed child who cannot even tolerate these vaccines right now. Live vaccines, oh my goodness, absolutely not. But they can. After 6 months, they're treated and they're in remission. That's when you can start thinking about, okay, we can give our child my immunizations as they're needed now. What can cause rheumatic fever? How about an acute glomerulonephritis too, right? Those are the two things that can cause it. How do we treat it? Treat the strep throat, give an antibiotic. An adolescent child, girl, wants information regarding birth control. What do? Can you give an adolescent information about birth control? Yes, you can, but give it to her in written and oral form, only information and not your opinion. You know, we can all say, yeah, you shouldn't be having sex, but that's not what the adolescent needs. They need information, written and oral, and answer questions about it. I mean, your opinion is not that it doesn't matter. You just need to give the information to this adolescent. I'll multi-select. Child with hemophilia fell down hard on her knee. What's the treatment? I mean, what do we worry about with hemophilia? I think the one thing that's the big thing is we worry about bleeding inside joints with children with hemophilia, and joint destruction is what our concern is. We don't want these children to end up to be adults in wheelchairs. So what do? We raise it, we ice it, we wrap it up and elevate it. Rice. That's number one. Number two, you're going to be giving her that missing factor, whether it's 8, 9, or is it von Willebrand's? Whatever it is, we're going to give that factor. And we're not going to do anything that makes the blood thinner. NSAIDs, including ibuprofen, can also thin the blood, and aspirin, so Tylenol. On multi-select. How do you decrease GERD in infants? Gastroesophageal reflux disease. I mean, I think this is the biggest thing that infants get. They're always spitting up somewhere. The problem is they're losing nutrition, aren't they? That's the biggest thing. So to decrease it, number one, make sure we burp these children frequently, that we have them sitting up after the feeds. The easiest thing to do, and we do it a lot, even in premature infants, we put a little bit of rice cereal in their formula or breast milk. It thickens it, so it holds it down. And also not to overfeed these children. That will also cause it too. So GERD can be treated very easily without medications. If this doesn't work, then we'll go into giving them the Pepcid, the Zantac, those sort of things. But usually just that works. I'll multi-select. What is priority information needed during the initial assessment of an infant with a fever of 101 and a cough? You're putting a kid in a hospital. You need to put him in a room. What do? Where do you put him? And why? So number one, I want to know the immunization status. Is this the flu? Is this COVID at this point, right? Furthermore, does this kid go in a room alone, or does it go in a room with another kid with the same thing? Or is it just RSV, right? I also want to know what medications, Tylenol, Motrin, when they had it, and always, 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 what are the allergies to make sure we don't give something they're allergic to. I'll multi-select. What precautions should be taken for infants born with a myeloma meningocele? Remember, we talked about that big purple blob on the back that doesn't go inside. The meninges and the spinal column are born on the outside of the body. So then we take it, and we get it back in there, and we know we have sensory, motor, usually deficits on the lower extremities. We're going to be watching for their urinary function, and we're going to monitor their bowel function. We don't know how much of those nerves are also damaged. And of course, latex. This has nothing to do with an airway. You're talking airway, you're talking about Guillain-Barré, right? You're not talking about myelomeningocele. Another one. A 17-year-old eats with a spoon upside down. And the mother said, is this normal? It's a 17-month-old. You know, a 17-month-old is experimenting still. They're not going to eat properly. At least they're using the spoon and not their fingers, right? So it's okay. Also, why is the mother concerned? Does she have another child, or is there other things going on? So, you know, address what the mother is trying to say. She's concerned about something. Why? And yes, as I said, absolutely normal. Multi-select. How is juvenile idiopathic arthritis treated? JIA. So JIA for pain is just NSAIDs. Motrin is probably the best one for children. As they go along and they need something more, when they have these big crises, when they hurt a lot, steroids are used, and they are very good. Methotrexate, sometimes it's used in conjunction with Humira, Enbrel, or infusions, and they're worked together. Synergist is for RSV. A toddler vomited 2 times, is listless and irritable. What do you tell the mother on the phone? Obviously, the mother's concerned. She's calling you. You know, my kid, 2 years old, vomited 2 times, but it's not acting right. We need to immediately get that kid to the ER. This kid is showing bad signs of dehydration, and you're going to say vomited 2 times. I've seen it in one huge vomiting that the kids get dehydrated. You don't know what their status was before they started vomiting, do you? So if they're not acting right, that means they're not getting blood flow, they're dehydrated. This kid needs to seek medical attention right away. And if they vomited, you don't want to give anything by mouth, because why? You'll just make them vomit more. So that's why those answers. An adolescent status post amputation for osteosarcoma is angry, and they're blaming their parents. So if you were an adolescent and you had to get an amputation, you need to blame somebody, right? Parents are always the ones that's going to get it. It's absolutely normal. They're going through a grieving process, and part of it is to be angry, and that's okay. If I had to have my leg chopped off, turned around, put back on, and had to use some sort of prosthesis, and I'm an adolescent, body image people, I'd be really upset. So it's absolutely normal. Another one. How do you assess children's outcomes that are on treatment for hypo or hyperpituitarism? Anterior pituitary gland, hypopituitarism. So literally, we're talking about growth. We're talking about height, weight. This is how we know that if they're on some sort of treatment for it, is it working? If they're too little, they're getting bigger. They're too big, they are getting smaller. or not growing not smaller, but not growing as quickly, right? So growth, height, and weight are what we look at when we're trying to measure this outcome. It's all about the growth there. Another one. To diagnose congenital heart disease, the child must undergo a cardiac cath. What are the risks to go under a cardiac cath? And if you look at this little catheter here, that's about the size they use even on infants. It's going into the femoral artery or femoral vein. Then they put wires in, and then they shoot dye in there. So what we're concerned about is number one, bleeding, right? Because it's an area where there's a lot of pressure and a lot of blood flow. So post-procedure bleeding is your first thing to check for. But you've inserted a catheter inside a vessel. So you might have occluded the amount of blood flow. So looking at those decreased pulses in lower extremity. Fever, pain, really not as much. It is the bleeding and it's the pulses. Another one. An infant with a TE fistula, what should the nurse have at bedside? Tracheal esophageal fistula, a connection between the trachea and the esophagus. That's how you have to look at what that means. What do you think can happen? So this child is not going to be fed because you aspirate, it's going right into the lungs. There's a connection between the trachea and the esophagus. You want the head of the bed elevated. You want suction at that bedside. They're NPO and they're going to be getting fluids until we get that fistula removed. How would you promote normal growth and development of an infant with an esophageal atresia? What is an esophageal atresia? A, without. There's no connection between the esophagus and their stomach. They can't eat. Our biggest concern is we want to promote growth and development, and that's the pacifier. How do infants soothe themselves, decrease their stress? Always in the mouth. And then after we get this fixed, they're going to be eating by mouth. So we want to promote that sucking. Another multi-select. A child has been having diarrhea for 3 days. What should the nurse assess? So diarrhea, 3 days. We're going to be worrying about dehydration. Blood pressure will be down, heart rate will be up, and urine output will be down. The temperature really doesn't have much to do with this one. How do we treat diarrhea? We give them fluids and we give them food. And we're going to give them a lactobacillus to slow down that stomach. And if we don't feed them and just give them fluids, they're still going to be squirting diarrhea. They're not going to have anything to solid it up. So they need to be fed, but an easier, bland diet, no spice. Another multi-select. What assessment findings would you see with a child with cystic fibrosis? Remember, cystic fibrosis is clogging of mucus in the lungs and the small intestines. There's a lot of issues with cystic fibrosis. Soul smelling stools, actually very foul smelling, very malodorous, they call it. Their lungs are going to be full of mucus that we need to do really good pulmonary care on. And because they're not getting nutrition, they're not getting fat vitamins, there can be growth delays on these kids. So you have to be careful. And not obesity, they'd be skinnier because they're not getting all the nutrition. Another multi. What assessment would alert the nurse for an infant that is in acute respiratory distress? Excuse me. So nasal flaring, grunting too, right? Tachypnea, and then you'd see intercostal retractions, and then right between the clavicle, supraclavicular, you'll see it pulling back. I call it retracting to the backbone. It is really significant in children that you're going to see that pulling in and out. But the nasal flaring, the grunting, tachypnea, all of these things, we know something's going on. What symptoms usually bring a child to the doctor and ends up with a diagnosis of acute lymphocytic leukemia? And it's, it's actually the one that my next door neighbor went to the doctor with. She was tired, she didn't feel good, her knees were hurting, and she had bruising she had no clue about. And they pulled her white count, and her white count was 0.01. It was extremely low. She's fine today. She has a PhD from the University of Miami, so she's done well. But those were the symptoms, clearly those that brought her into the ER. A multi-select. When teaching a child about sickle cell disease, a nurse should include what? Sickle cell disease is an immunosuppressive disease. It's all about the cells not moving around the way they should. They get stuck. And we know that hydration is key on these children. But one of the big things is these children, if they have a fever greater than 100.5, they have to get and be placed on antibiotics. There's no immune system. They can't fight this infection by themselves. So they need to go to the doctor for that. And also with any pain medicine, they're always sent home like on Tylenol number 3s or Tylenol number 4s, depending on how big the kid is. Take it before the pain gets too bad, because then it's not going to work. A newborn is diagnosed with transposition of the great arteries. What is the priority treatment? You have pulmonic circulation and systemic, and they're not meeting each other. There's no connection. Your body is not getting oxygen. And what we need to do is put them on medicine to keep the patent ductus arteriosus open. Remember that patent ductus arteriosus is fetal circulation. It's kept open by mommy producing prostaglandins. But after mommy's gone, the baby's out, no more prostaglandins are being formed. But we do have synthetic prostaglandins. It's a slow, continuous infusion of it. And we don't have to do the switch immediately. We can wait for a week or so. So it's a planned surgery. It's not an emergency. As long as this kid gets oxygen, and they do, their O2 saturations are 99, 100, just keeping that little duct open. A child with sickle cell disease goes to the ER with severe pain in the left knee. What's the priority treatment to decrease the pain? What do you do first? Remember what a sickle cell disease is. Cells have clumped up in a vein because they're flat and it can't get through. And if they can't get through, it's building up more and more and more and fluid behind it. And all of that is causing the pain. Number one priority, give fluid, dilate the vessel, let those sickle cells get by. And at the same time, you're going to be giving pain medicine, but priority, fluid first, because that's how you treat it. If you give pain medicine, you're just treating what you see, the symptom, not why it happened. It happened because the vein is flat. The cells cannot get through. Give a bolus and those will go through and it will decrease the pain, and the pain medicine will help too. Multi-select. What is a VP shunt used for? Ventricular peritoneal shunt. We use these a lot with children with myelomeningocele. because the cerebral spinal fluid can't travel up and down the way it should. So if I'm telling you it's relieving the cerebral spinal fluid, it has to do with fluid on the brain. Many children without myelomeningocele, for some reason, the fluid cannot get down up and down the spinal column the way it should. So the head is big, and we know by a big swollen fontanelle, we can see it, plus measuring, the head circumference. So this shunt goes from inside the brain, fourth ventricle, comes behind the ear, goes down the front of the body, and the rest of it goes into the peritoneal cavity, and it drains fluids. So it releases the fluid and it drains it for it. So ventricular peritoneal shunts are used for hydrocephalus. What would you see with a child with autism? Constant, repetitive behaviors. Very good. Sitting in the corner by themselves, not looking at you, not listening to you or name calling them. They don't like lights, they don't like noise, they don't like people, and they're going to be in the corner doing things by themselves over and over and over again. I'll multi-select. An umbilical hernia has become hard and painful. What should you tell the parents to do over the phone? So they've called your office. That little umbilical hernia that used to pop in and out. It's painful. The kid's crying. It's red. It looks horrible. I touch it. He screams. What do I do? What's going on? So this child has an incarcerated hernia. That means the intestines have twisted and now blood flow is stopped. And this child's about to lose a piece of intestines if we don't get them immediately to the ER, immediately to the OR. So number one, make them NPO. This kid needs to go to the OR quick. And then they can go in, pull it out, repair it, and put a mesh on the umbilical hernia, and we can save intestines. Incarcerated or strangulated hernia. That's what's going on. At what age should solid foods be introduced to an infant? And we do one at a time, about 4 to 7 days in between each new try, because earlier than 6 months, the body does not absorb it, doesn't use it, and you'll just see the food in the stool. At 6 months, now their body, their GI tract is mature enough to be able to absorb and use the food. When do we start whole milk? 1 year. 1 year, very good. How would a nurse explain to a newborn with suspected cryptorchidism? How would you examine them? What's a cryptorchidism? Means testicles are not in the sac where they should be. But how do you make sure? Maybe they're just not there right now. So put them in a room that's warm. Any of you who know men or have your own testicles, when it's cold, they suck up. So they're going to be up higher. You can't feel them. When it's warm, they tend to hang. And that's when you can find if the testicles are in the sac. Because if not, they're going to need to have surgery to pull them down. What acid-base imbalance is caused by hyperventilating? Remember I told you you're going to see a lot of ABG type questions. So please review this before you take your HESI, whether it's diarrhea, vomiting, or hyperventilating. Hyperventilating is respiratory alkalosis. You're getting rid of acid. So it's going to be alkalotic. I'll multi-select. A child has fallen, got a stick, and they scratched their eye. They've called you, and what should you tell the parents or the child to do? You know, they could fall into a tree, into pine cones, on the ground, into a bush, doesn't matter. You know, they can get their eyes really scratched and damaged. Number one, you should not touch their eye, shouldn't pull anything out of it. If there's something floating, you can take a tissue to get it, but basically leave it alone. You put what we call fox shields, and they say put it over both eyes. Get them to a pediatric ophthalmologist or an ER, and then they can decide, can they pull it out? Does the kid need to go to surgery? What needs to happen? It is an emergency because kids could lose their eye if we try to pull stuff out. A school-age child has reoccurring dermatitis, eczema. What suggestion would a school nurse provide the parents? You know, this is not, you know, an uncommon thing. Children have a lot of allergies, and some of them do have eczema, you know, and they're sitting there itching and scratching all the time, right? So what they say you should do is when the kid is ooey and gooey, like infected, keep them home. But once they're dry, they're fine, they can go to school, okay? Has nothing to do with wearing gloves or whatnot. It just has to do with when they're not doing well, they're ooey gooey, keep them home. Because then they don't get infections from the school and everybody touching them. A multi-select. Why would you give an aspirin to a child diagnosed with Kawasaki disease? Now, one of the things about Kawasaki disease, they get these big red glow in the dark eyes. And I'm telling you, they're that red. It's like, wow. When I see that, I can start looking and I know something's going on. I'm going to see the strawberry tongue, maybe a rash. I'm going to see the peeling of their hands, of their palms and their soles of their feet. But they give IVIG and they give aspirin. Only time we give aspirin to the babies or children. Usually these are toddlers that get this. But what is an aspirin? Well, number one, it thins the blood, so it prevents clots, and it also is an NSAID. It's an anti-inflammatory. Pain relief, they don't really have pain. So it's the other stuff is the reason why we give it. Pain relief, we'd give Tylenol too. Newborn child has suspected congestive heart failure. What confirms this? Newborn. So they call it, they're breathing fast, and then you're going to see that centralized cyanosis when they're crying, you can see it. And then of course you can go and listen, you know, and find out also. Some children are born that way. You really be surprised what newborns can do to you. I've worked at facility where I used to get the newborns right into the newborn ICU, and I was able to assess them. Some crazy things I've seen at birth. How do you medically close a patent ductus arteriosus? Medically, that means with medicine. What closes that PDA? Because we know to keep it open, you need prostaglandins. To close it, you need to stop the prostaglandins from working. And you do that with indomethacin. The NSAID, it's actually an NSAID, indomethacin, given IV, stops prostaglandins from being secreted and the duct closes. Then I'm going to ask you, how do you know it closed? Well, the PDA has a machine-like murmur. You can hear it. Once it starts to close, that murmur goes away. And you don't hear it. Pretty cool. It's one of the ways I used to watch it. A child post-tonsillectomy is swallowing every 2 minutes. What does the nurse need to assess? So if they're swallowing, they're probably bleeding. I've actually seen bleeding to the point where they've gone into shock. So much blood came out of them. So if they're swallowing, Number one, have them lean forward and let them spit it into an emesis basin or a bucket, whatever you need. And then, of course, these children need to go back to the OR and they cauterize it. So one of my career, he went into Bulimic Shock so quickly. A child is walking on their tiptoes all the time. What would you tell the parents? Like all the time, like never on the feet, just always on the tiptoes. And there's something going on. And I would tell you a story. One of my daughter's friend's kid, I just met her. She was 3 and she was always on her tiptoes, but she also was by herself, didn't respond, had all the signs and symptoms of autism looking. So they finally got her into treatment. This was right as COVID hit. Got her into treatment and now she's starting to walk normally. It was part of an autism spectrum. That was it. So refer to the neurologist is what helped. How do you treat epistaxis on a child? So if you have a nosebleed, you take your thumb and your forefinger, pinch it, have them sit forward, and after 10 minutes, it's still bleeding, they need to go seek medical treatment. Go to the doctor, urgent care, ER somewhere. It needs to be taken care of. I'll multi-select. What might you see with a child experiencing severe diarrhea? As I said, there was 4 acid-based questions on the last HESI. So I tried to hit you. If you ever looked at the rest of the Kahoots I do weekly, you'll see a lot of acid-based questions in there. That's why. So if we're losing fluid, of course, hypovolemia, hypokalemia is always you look for, but you're losing a lot of alkaline out of your, with the diarrhea because of the digestive enzymes. They're alkaline. So you end up with metabolic acidosis. If you're vomiting, you're getting rid of stomach acid, right? Then you're metabolic alkalosis. So you've learned 3 different types of acid-based ones in this sitting today so far. A parent called the nurse to ask what over-the-counter she can give her child. She's having welts on her arms and now it's going up her neck. What do you tell this parent? Well, if a child's having welts and now they're moving, this kid needs to get medical treatment. They could be going into anaphylactic shock. You don't know by asking over the telephone, okay? So get this kid to treatment. What lunch would you choose for a child with celiac disease? Wheat, rye, barley. They can't have. They can have rice. So all the other stuff had some sort of breading. Chicken, coleslaw, soda, frozen fruit, dessert, omelets, eggs, ice cream, all that is fine. It's when you put anything with bread on it. A multi-select. What treatment should you, with a child with JIA have? What treatment should a child in pain with JIA have? I mean, I have rheumatoid arthritis. What do I do for me? So NSAIDs, and you can either give hot baths or cold baths. Now, some children like hot baths. You put me in a hot bath, and I'm going to scream in pain. I want an ice bath. So it depends on the person. And of course, distractions work for everything. Highest priority for a child with sickle cell. And we know we treat this with what first? We're going to be giving them IV fluids. Now, fever is life-threatening on a child with sickle cell disease, okay? That's why if the temperature is 100.5 or greater, they need antibiotics now. So yes, pain is bad. We want to treat it, but the priority treatment is actually making sure they get that antibiotic because of a fever. A mother tells the nurse that her infant sweat tastes salty. What should the nurse do? We're going to test for cystic fibrosis. I mean, the other thing that happened with cystic fibrosis is a child at birth who does not have a stool within the first 2 days. And we will check them for CF. At that point, we find CF if the mother say, if you lick your child, you're going to taste the salt. That's why we do not restrict salt on cystic fibrosis children. They need salt. They lose salt. I'll multi-select. How do you diagnose hip dysplasia in an infant? So the positive ortolani, you're going to hear clicking. That leg is shorter because the leg comes up and it's on the upper side, so the leg's not where it should be. And of course, looking at their buttocks, we're going to see the folds are a little bit differently. That foot pointing inwards, outwards, you see that on the elderly and hip fractures. You'll see that foot pointing wrong, not on infants with hip dysplasia. Why do sickle cell patients have enuresis? Well, the one thing about sickle cell patients and children, we teach them that they should be well hydrated, because if they're dehydrated, that's when the cells will sickle up and get caught. So they're drinking extra fluid. Because they're drinking extra fluid, they can have bedtime wetting. And that's the reason why. As simple as that. What causes acute glomerulonephritis? Or is that rheumatic fever? It's that strep infection again. Glomerulonephritis, you're going to see no urine output, or it's going to be bloody or really dark tinged. You're going to see high blood pressure on these children. How do we treat it? Treat the strep infection, and everything will go back to where it should. I'll multi-select. What may be a problem seen after a child has cardiac surgery? So again, remember, you've taken a heart, you've opened it, you repaired it, and you've sewed it back together again. Think about it that way, cardiac surgery. Because the muscle has been, cut open, etc., they're going to fatigue easily. They're going to have poor appetite. They are going to go into respiratory distress. They're not going to be eating that much. So constipation really isn't a problem with it. But with all of these things being said, what am I going to monitor closely? Their respiratory status, making sure that they're not building up fluid in their lungs. A diabetic child is brought to the ER, unconscious, blood sugars are greater than 600, labs are drawn. What is your priority treatment with this child? Priority. What do you do first? Fluid, 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 fluid. And then you're going to start a slow drip of regular insulin. You can do that, okay? We're not going to do no sub-Q insulin, no. start an IV bolus of normal saline. These children need the fluid, then start that IV slow infusion of regular insulin and monitor blood sugars very quickly. This kid is probably DKA, right? So we're going to be monitoring potassiums and all that good stuff. But our goal, get an IV in, get fluid in, and then we'll start the insulin. When administering indomethacin to an infant, what is the expected outcome? Well, what do we give indomethacin for? It's for your patent ductus arteriosus, right? It's the medical treatment. So what would you see? What do you want? You want the murmur to go away because that is the PDA. Yes, you were listening. Yes. The parents of a boy who has Duchenne muscular dystrophy wants more children. What information should be provided? So Duchenne muscular dystrophy is from mom. It's X-linked recessive, and it will affect another male child. So this is what they need to know if they indeed want to go forward and try to have another child. Remember, it's progressive muscular wasting that eventually hits the respiratory and the cardiac system. And usually as teenagers, they do die. So do they want to have another child? A multi-select. What behavior by the child should alert the nurse to request a follow-up for possible autism spectrum disorder? So again, autism, what you think of, that odd repetitive behaviors, and they do it, could be 20 times over and over and over and over again. Again, they do have that indifference to verbal stimuli. They don't care if you're there. They're not going to look at you. They're not going to respond to their name. You know, these things are part of it. The temper tantrums, not all autistic children do. And they're not really going to sit there and take a doll and stroke a hair. That ain't going to happen on these children. These children want to be left alone doing those repetitive behaviors and whenever they want. They don't want to really pay attention. When an infant needs to be on enteral feedings, what can help to promote normal growth and development? So again, pacifier. We need a pacifier so they can suck on it because that does promote normal growth and development. We said it before. I gave it to you in a different way right there. A multi-select. A complex child is complaining of muscle weakness. What could cause this? Muscle. What do we know about muscles? What affects muscles? When you think of muscles, always think of calcium and magnesium. That's first of all. And then of course, low potassium, we can also have that weakness that's also going on. Remember hypocalcemia? This could be because of hypoparathyroidism, right? Because that is again, not enough calcium. So taking this and putting it into the bigger picture, okay? A multi-select. What teaching should a parent understand about a 4-year-old with a urinary tract infection? So if a child has a urinary tract infection, always increasing fluids help. Cotton underwears, none of these nylon synthetic things. And the big thing that we tend to forget is once a child has a urinary tract infection that has been treated, make sure they go back and get a repeat to make sure that that infection is indeed completely gone. What is priority treatment for a child with cystic fibrosis to prevent respiratory complications? So with cystic fibrosis, all the fluids that you want to drink aren't going to help. You need to keep that stuff in there loose and moving. And that's vigorous, aggressive chest physiotherapy. It's using those vests that shake them and using CPT and giving aerosols to help expectorate, keep that stuff moving. It's like a big petri dish in there. What is otitis media? So it's basically a middle ear infection. As simple as that. That was a question a couple times back on HESI, so I had to throw it in there. What would you recommend for a toddler who mostly uses gestures to convey their wishes? They're just, instead of talking, they're just using sign language and so remember when you talk about speech, always think about hearing. You think hearing, you think about speech. They're interconnected. What prophylactic treatment should be given preoperatively with large abdominal surgeries? You know, one of the evidence-based things that came out with a dose of antibiotics before prevents surgical infections prophylactically before surgery. The other thing is antiemetics. If you've had abdominal surgery and you vomit, it hurts. So to prevent that post-op nausea and vomiting, to give an antiemetic before they go to surgery has been found to be very beneficial. A child with ADHD is out of control and sent to the school nurse. What should she recommend? Attention deficit hyperactivity disorder. So we should be sending them to the psychologist because they're more the experts on this. Another thing is, you know, we've discussed before, a child who can't sit and out of control, we need to listen to the parents to find out what they've already done for these children. You think maybe they're spoiled, don't want to listen, you know, that's not disciplining them. It's not going to help. You know, some of these children do need more than that, and everything's been done at home. So referring them to a psychologist is actually the best thing for these children. An adolescent is asking her mother to stay with her. Why? She's in a hospital, wants mom to stay. It's not usual for an adolescent. So they are regressing back. You know, an adolescent who's sick, you know, wants to be, you know, mommy there or daddy there, somebody to hold their hand. You know, their friends are not going to be there the way they should. And, you know, they don't want their friends to see them sick and vulnerable. That's what adolescents don't like. They still want to be these strong people. It's all that image. A multi-select. A toddler is noticed drinking soda from a bottle. What should the nurse discuss with the mother? Well, number one, a child ages 1 to 3 shouldn't necessarily should be drinking from a bottle. They need a sippy cup, right? Also, all that sugar could lead to rotten teeth, and it also can lead to a child to be obese because all of the extra calories that they're ingesting. So this should something that you should discuss with a parent. And last question. Biopsies are not done before the removal of a Wilms tumor. Why? Wilms tumor is this big tumor that comes off the kidney, the adrenal gland, somewhere around there. I've seen one in my career. And this is the one that we don't touch, right? So if we can't touch it, why would we want to do biopsy and puncture it so we can allow all the cancer to go into the peritoneal cavity? We don't. If we see that tumor there, we know what it is. We don't need a biopsy. So we will not be doing a biopsy on that one. So let's see how you guys did. You stuck with me. Mac, number 3, number 2. JK. And Cookie the whole way through with Michelle and LK. Guys, that was good. I appreciated you coming. If you need anything from me, let me know. I'll be posting this a little bit later on, so you'll have it today, okay? Because I know that this is the weekend you're studying for HESI. So thank you all for coming. Appreciate it. I wish you the best. 1,300 on a HESI, okay? Let's all get 99.99. Whoop, 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 whoop. Have a good day, guys.
Thank you.
You're welcome.
Thank you.
You're very welcome.
Thank you.
My pleasure.